This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, can you talk about the benefits of non-invasive embryo testing and how it compares to traditional methods?
Okay, yeah, so selecting the best embryo. When a woman goes through an IVF cycle, if she's fortunate, she'll end up with 2 or 3 embryos. If she's under 38, it's highly likely that she'll end up with 2 or 3 embryos. And the question is, can we pick out which one's the best embryo? Up to a point, it is an academic exercise, because if they're good embryos, we put one back and freeze the other 2, and then if that doesn't work, we come back and replace the next one and the next one. And if there's a good one amongst the 3, by the 3rd time, we'll actually hit jackpot. So selecting embryos at the end of the day probably doesn't change the ultimate outcome for the chances of a pregnancy, because a frozen embryo has as much chance as a fresh one. However, 3 cycles is 3 months of time, 3 months of stress, and if you can hit the button on the first go, then the woman suffers much less psychologically, much less financially, because each of those cycles costs money. A lot of focus on how can we pick out the best embryo. The main reason why there are good and bad embryos is that the genetic makeup of the embryo is wrong in some embryos. So when you're 30, something like 40% of your embryos that you create will be genetically abnormal and be doomed even before they're put back. By 40, that's reached 70% of your embryos are genetically abnormal. Your chances of pregnancy are much less at 40, and at 45, it's getting up towards 95, 98% of embryos will be genetically abnormal. Testing the embryo before we put it back is one way of being highly selective in terms of increasing your chances of a pregnancy at the earliest opportunity. However, that's invasive. To achieve that, you need to biopsy the embryo, which has a small risk, probably 2%, of damaging the embryo. So we try and avoid that if we can. And then but that brings us back to non-invasive techniques. Now, there are various approaches. Our scientists over many years have been able to look down a microscope and decide whether an embryo is a good one or a bad one to a degree of ability. So if you compare it with genetic testing, they'll get it right in about 60 to 70% of the cases that this will be a good embryo. What they're looking at the day 5 is the shape of the embryo, the number of the makeup of the cells on the outside of the embryo that will become the placenta, and they look at the lump in the middle, in the fluid in the middle, which will become the embryo. And they grade that. Various systems of grading, 1 to 4, or A, B, C, D, with A being the best for those. So an AA embryo is the best based on purely more looking down the microscope. So that's pretty good, actually. And we know that the AAs do better than the BBs, and they do better than the CCs. So we are able to differentiate the best embryo that way, and that's non-invasive. Other things have been suggested. There is something called time-lapse photography with the embryoscope, where they can look at the development of the embryo and watching those stages of development. So it goes from 1 to 2 to 4 to 16 to 32 to 400 cells. Each of those stages, if they occur at the right time, increases the chances of that being a good embryo. So that is some assistance, but not necessarily totally convincing. Then people have looked at measuring things in the fluid around the embryo in the culture disc, measuring chemicals, looking at cells or DNA in the culture medium and seeing whether that helps without having to actually biopsy them for DNA. Again, 80 to 90% accuracy, but not 100%. So non-invasive approaches is what we're looking for because it doesn't damage the embryo. But so far, there's nothing that's really proven to make 100% success.